Good evening, everyone. I'm Paul Kagebein with the Garland County Library here in Hot Springs, and I'm here this evening to discuss the ongoing COVID-19 pandemic with Dr. Gene Shelby. He's the Garland County Health Officer, and Dr. Shelby has held that position since 2004, and he's practiced emergency medicine in Arkansas for about 30 years. And I encourage everyone watching live to submit your questions in the comment feed for Dr. Shelby, and we'll try and get to as many as we can. So Dr. Shelby, before I begin bombarding you with questions, I'll let you begin with any opening remarks you may have and by reiterating the most up-to-date numbers we have available.
As Paul said, I'm the Garland County Health Officer, and Garland County Health Officer is actually it's a volunteer position. I work mainly with the local health unit, but also in contact with the state health department in Little Rock. Generally, it's not a too difficult job, but things have kind of changed a lot this year with the COVID pandemic. And one of the things that I've been really proud of the Garland County and Hot Springs is we really got on this early on. The leadership in the city and the county, in the Fire Chief Davis, they really started to develop a kind of a COVID test or task force, and we started meeting really the first part of March, and it's been really a useful exercise to kind of share information amongst the different stakeholders in the city and the county, and I think it's really has really enhanced our ability to respond to the pandemic. We currently meet on a Zoom meeting every Monday morning. We have the city manager, the county judge, representatives from the police office, as well as the sheriff's office, and it's kind of coordinated by Chief Davis at the fire department, and we also have representatives from the hospitals in the ambulance service, the Bo Robertson with the Department of Emergency Management, and then here recently we've added the school superintendents in the different school districts in Garland County, again to be able to kind of coordinate our response and also kind of share information. One of the things that I do at this meeting is I give a weekly update on how things are going, or where our numbers are in the county, and kind of identify trends, and then we discuss how best we can manage things to try to do what we can to stem this pandemic. It's certainly an unprecedented thing for all of us. It's a real challenge and to the community, and it's got ramifications that's going to last for a long time. But I think that by the fact that we got started early, we were really able to do some things to kind of mitigate the disease here in Garland County. In our first meeting in the first week of March, we were able to set up our own local call center, which I think is very important. The state and national call lines, but I think having someone locally to answer questions specific to our community has been a real asset, and that's been coordinated through the nursing department at National Park College. And Janice Ivers has done an excellent job of manning that, and really relaying a lot of fears for people calling in, as well as give them some good information. Also, one of the things we were able to do very early on is that we had before we had very widespread testing, we had 4 units set up around the county where people could go to be screened, and then we are also able to do some testing at those sites, and I think that's really helped us during the early months of the pandemic in Arkansas. by setting this up and really emphasizing testing, we were doing more testing, certainly on a per capita basis than any county in the state, and I think that was a real important thing, and it's been an interesting project to kind of see how the disease has done here in Garland County. During March and really through April and almost through May, we were doing an excellent job of testing and really identifying people that did have the virus and doing the important work of contact tracing. And kind of look back on those numbers, especially in May, we were only seeing 3 or 4 positive cases per week in Garland County. There was, even though the week ending on May 10th, we had one positive case the whole week. And again, we were doing the testing, so our positivity numbers were most of the weeks there was 1% or less. But certainly things have changed a lot since then. We really in June, I really felt like that the Memorial Day weekend it was a real turning point for us in Garland County, because after that we saw our numbers really double on a weekly basis, and then we came up on the 4th of July weekend, and we had another doubling of our cases. We were in June, we were seeing like 50 new cases per week, and but by mid to late July, we were seeing close to 200 new cases per week, and with us, and our testing was going up some, but our positivity rate was going up much faster. In August, our positivity rates were in the 10 to 12% range, and continued on that way for a long time. Fortunately, we're kind of in a plateau, and we have been over the last 5 or 6 weeks. Fortunately, we had a small spike after the Labor Day weekend, but it was not near the severity that we'd seen with the Memorial Day and the 4th of July holiday. And so over the last 5 weeks, we've been pretty constant. We're seeing about 120, 130 new cases per week, and in our active cases, people that have not recovered from it, it has also stabilized pretty well in about the 140 range. We do have some fluctuations, but one of the real good aspects of where we're at now is that we really ramped up our testing here in Garland County. We've actually gone from having about 1,000 tests done per week up to this past week. We had over 4,000 tests done. So we've seen a really gradual but significant downward trend in our positivity. We were in the range of 10% of our tests coming back positive the latter part of August, and but since then, we were down, and this past week our positivity rate was down to 3.9%, and so we're really one of the leaders in terms of the larger counties in Arkansas in terms of the amount of testing we're doing and the way that we have been able to get our positivity count down. And part of that increased testing is the state has had a stronger emphasis on the testing in the nursing homes, and so they're testing not only the residents but also the staff at the nursing homes on a regular basis, regardless of symptoms or anything. And so I think that's been a real plus for us here in Garland County, I'm sure around the state also, is to really, the importance of testing is to identify people and so they can do the proper contact tracing and isolate that and reduce the spread and hopefully at some point continue to get rid of this virus, though it's still very, very much with us. One of the things I make my report at our weekly meeting is these numbers that we have, but also as the county health officer, I do have access to the state database for Garland County of the people that are active cases and also people that are under investigation by the county, and so it has quite a bit of information about those individuals, and so I try to do some analysis of those. The main things I look for is the distribution of the cases around the county. Most of the cases are in the city of Hot Springs and the unincorporated areas of Garland County. We do have a small spike in the Royal area, not a real high spike, but we do see a number of cases and have seen a number of cases there. And of course, the Hot Springs Village portion of Garland County, we've seen some cases there, but by and large, the number of cases there has been very small, and so I think that generally they've done very well in terms of preventing the spread there. Another thing that we look at on a weekly basis is the number and the percentage of people in the Hispanic community. We did see a spike in the Hispanic population in the latter part of the summer, and also we added to our task force team 2 nurses that are Hispanic and have been a real asset in helping us reach out to the Hispanic community. And I think we've had some real positive results from that outreach. And our at one point our percentage of our positive active cases in Garland County in the Hispanic population was up to 10%. But now this past week it's down to 2%, and I think that is a result of really the community coming together with members of the Hispanic community, and also the Chamber of Commerce has really been helpful in identifying especially Hispanic businesses, and so I think that's been one really good thing that's come about from our task force. Another thing that I look at on a weekly basis is our age distribution of cases around the county, and that's one thing that has been kind of a potential problem I think that we're going to have, is that we've seen a higher percentage of our cases in the over 65 age group. We're up to about 25% of our cases are in that age group, whereas the state average is more like 12 or 13%. And I'm fearful that that's going to foretell that we're going to have more deaths here in Garland County. We've already started seeing a spike in our deaths in August, and in September we're up to over 55 deaths in the county, and I think with the high number of older people that are in our positive, that we're likely to continue to see the deaths continue on, and also when I kind of talk about that is that I want to remind everyone that what we're dealing with a really deadly infection that a lot of people around in our county, around the state, and out in the country, and around the world are dying from this. And even though we've been in this for several months, and we kind of become, I don't know whether it becomes kind of the new norm, but I think it's important to remember how dangerous and severe this infection can be, and and I think that should be a motivating factor for us doing all that we can to prevent the spread and try to get a hold on this deadly disease. And we've also, monitored our school age group of people, and we did see somewhat of an increase in this group, the 0 to 17 age group, since school started, and our school districts have been very impressed with the good job that they're doing to do everything they can to keep their students and their staff safe, but continue the important work that they do in education. So our numbers in this group it's kind of peaked out at about 22%. And over the last week, we've seen that it's come down to about 15% of our cases are in this age group. Like I say, on our call, we now have the school superintendents, and they're very vigilant about what they do and the procedures that they have set up. And so I think one of the reasons we're seeing larger numbers is that there's just more awareness of it. One of the things that the state health department has done is as they distributed the rapid antigen testing to the health unit, and we have one of those here in Hot Springs, and they're used exclusively for students and staff at our schools that show any kind of symptoms, where they can make arrangements through the county health department, and they can be tested and have a result within 15 minutes. So those are kind of some of the main things that I look at, and what our task force looks at on a weekly call.
Well, thank you. That was an extremely informative overview. And just a couple things for the audience. We're going to try and be here until around 7. So if you have any questions, please comment them, and we'll get to as many as possible. And also just want to apologize if the lights go on and off. I'm in a different room than I'm usually in, and if I don't keep moving, the lights will go off on me. But moving on, or moving back a little bit, talking about our death rate, do you have any demographic breakdown for those who have passed away so far, such as age or race?
I don't have it on our county-wide, but I don't have any reason to believe that ours would be any different than around the state, except one of the reasons we have a higher number of deaths, because we do have an older population in Garland County. But on a statewide basis, there's about 70% of the deaths are occurring in that age group. Not to say that the other age groups are not affected by it. I think the second largest is in the 45 to 64 age group. Fortunately, we're seeing that there's very little severe illness in the less than 20 age group. So, but as far as any kind of specific, I don't have that, but I suspect ours is similar to the statewide numbers.
Thank you. So we're at a statewide high of hospitalizations. As of yesterday, that number was 529. Can you talk more in detail about how Garland County's hospitals in particular are doing?
Yeah, they report each week, and as a general rule, there was a while back, I think in maybe in July there were really no cases in the hospitals, but certainly over the last month or two they've continued to have cases on a regular basis and deaths on a regular basis. I don't think we have come anywhere close to maxing out our capability to take care of the people that are ill from this infection. And I know both hospitals have contingency plans in set up in case that we do have a higher hospitalization rate than what we're having now, in terms of bringing in additional staff and having the places in the hospital to take care of these people. So it is occurring, but I don't know that we've had a really marked spike in the number of hospitalized people with this disease.
Governor Hutchinson announced yesterday that the restrictions regarding visitation to long-term care facilities will be relaxed in several ways. Could you go over those? And does this give you any concerns about transmission of the virus, both in and out of nursing homes?
Well, I don't have all the specifics of it. I think that they still have a lot of requirements before they're allowing visitors. I think they did set up where they can have some exceptions for nursing home residents that have real severe mental issues related to the isolation. But I think that one of the important things that we're doing is expanded our capability of testing. So we're identifying and isolating people early on, and also I think one of the things that has shown up in our numbers over the last couple of weeks is that with their testing, the staff at the nursing homes, and really identifying a number of staff people. In this past week, out of the 200 people in our database that were positive or were under investigations, 28 of those were healthcare workers, and I feel like the vast majority of those are from the nursing home. So I think that the nursing homes are doing a really good job under very difficult circumstances. I think that if we can move forward with the visitation, I think that's a good thing. But I really feel like they have the protocols in place to keep it safe, and if they do have cases, they'll have to shut down the visitation. So I think that again, I think the key thing about this is the increased testing, especially on asymptomatic people that are in and out of the nursing home.
Just got a question from Eric. He asked, what's distinctive about COVID-19 from other respiratory sicknesses?
I'm sorry, I didn't catch that.
Eric asked, what's distinctive about COVID-19 from other respiratory sicknesses?
Well, I think what the main thing is it's so contagious. It's about 5 times more contagious than the seasonal flu, and it's also much more deadly. And it's a new virus. It's certainly a lot more is known about it now than say back in March when it first became an issue around here. And but it has some different characteristics than other viruses, and that's being studied. There are lots of different things. It affects the lungs, but it also affects how the immune response to the virus can really cause a lot of problems, and that kind of really makes it more deadly. I think one comparison that is very telling is compared to the seasonal flu. The flu, it's a really bad disease, and in some more so in some years than others. But one thing that I think Dr. Dillahay at the health department mentioned a few weeks ago, and I thought was made a very good comparison. We usually have, and then like last year we had like 120 deaths in the state from the flu, but with the COVID-19 here in the last 8 months, we've had 1,400 deaths. So you can see, the lethality of this virus is I mean, it's very, very disturbing, and it's very real though.
Right. That actually brings up another topic I wanted to discuss. I actually saw just yesterday, according to data taken from Johns Hopkins University, more people in the U.S. have already died from COVID-19 in 2020 than in the past 5 flu seasons combined. And that number is growing. It's about to hit the last 6 flu seasons combined.
Yeah, usually there's about 60 or 70,000 Americans that die from the flu every year, and which is, I mean, that's disturbing, and I think some people don't take the flu as seriously as they should. And one of the things that I find bothersome is the fact that only about 50% of the people, take the flu vaccine, and it's a very widely available vaccine. Anything can have can cause some side effects, but it's a very safe vaccine. Some people say that they get the flu after getting the flu shot, but that's literally impossible to do because it's a dead virus, and it can't cause an infection. Some people do have some reaction to it, and it can have some soreness at the injection site, and sometimes you can even have a slight fever, but it's not the flu. But yeah, it's something that we're entering the flu season, and that's going to really complicate things a lot in dealing with the COVID virus, because they're a lot alike in terms of the initial symptoms, and so it's going to be a challenge dealing with people with the seasonal flu to make sure that they don't have COVID also, because you can certainly get both of them.
Right. Yeah, some people are calling this alarming combination the twin-demic. So there's definitely a lot of misinformation going on about how serious COVID is compared to the flu, and vice versa. So other than comparing it to the flu, are there any other myths or superstitions you hear a lot from people that you can debunk?
Well, I think that we've been in this for a long time, and people are getting tired of the things that we have to do to try to slow and eventually eliminate the spread. I think it's been well proven that properly worn masks do make a big difference, and I don't know that everyone really accepts that or have gotten used to wearing the mask. But that's something that is vital in order to stop the spread of this, and it can be kind of a hassle, but it's something that's effective, and certainly we as a community really need to do all we can to stop this virus, and that's something that everybody can do.
Right. You discussed earlier how Hot Springs and Garland County in general, our numbers were pretty decent until holidays started happening. We just got a question from Maurice, who wants to know if Hot Springs as a tourist town classification would have much impact on the cases here.
Oh, I'm certain that it does. And Hot Springs has a long history of being a tourist destination, and I think that's something that we're proud of, that people like to come to Hot Springs, and but I have no doubt that that's played a big role in the pandemic in Garland County. You can just see it in the numbers. I remember talking at our task force meeting in May, and say, we were down to like 3 active cases in the whole county out of 100,000 people, and that if we could have built a wall around Garland County, this COVID-19 would be history. But obviously that's not going to happen, and it's not. We don't want it to happen. So I have no doubt that being a tourist destination has made it more challenging. But again, I think that everybody kind of realized that from the get-go, and that's why we've had really good buy-in from the tourist industry, and realizing that how important it is to do the things that we can do to prevent the spread. But and actually one of the things that we emphasized back in May, starting in May, that we had the testing sites available, and Steve Aronson and Gary Troutman with the chamber made sure that all the hotels that interacted with tourists, that if people wanted to get tested or had questions about what was going on in Garland County in terms of the COVID, that we about our call line as well as our testing centers. So I think that was a part, but I think that's been one of the reasons that I think overall we've done well despite that.
Are there any type of activities that people in our area, both residents and tourists, should think twice about doing?
Yeah, I mean, I would say if you any kind of crowded situation, certainly bars where people are talking loudly and not social distancing, I think that you just have to be real cautious. I think that the proprietors of these certainly restaurants as well as other gathering places, I think they really buy in and know how important these things are, and our certainly our law enforcement. I think that they're doing all that they can, and certainly we're ready to respond if a business or patrons of a business are not following the mandate, that they're taking action. Like I say, I think there's definitely really good buy-in from the leadership in the county to do all we can to slow this down.
How has from your perspective, the compliance of mask mandates been going locally?
Well, it's hard to judge. I would say that sometimes it's spotty when you walk down Central Avenue, and I think we see more people wearing masks, but there's certainly large groups of people that are walking down Central Avenue with no masks, and I do believe that the businesses are they're trying to enforce that, and I think they're probably doing a good job. But we certainly saw the pictures on Memorial Day of large groups out on the lake, not wearing masks and not socially distancing, and those were very bothersome activities, and it's just but people kind of ask when we're going to be able to stop this. I mean, I say it's not anytime soon. I mean, this virus is going to be around for a while, and the only thing we can do is be smart and do the things that we can to prevent the spread.
So according to the latest data from the New York Times COVID tracker, the state of Arkansas has one of the most rapidly growing case rates per capita out of any state in the past week. And the death rate per capita is actually the second highest of any state in their tracker. What factors do you think are causing this growth at large across the state, and how concerned should Garland County be about the rest of the state, other places that may be considered hotspots?
Oh, I'm not, I'm not that familiar with what all's going on in different other areas of the state. Certainly,
Sure.
There's a big problem with the prison system, and I think there still is to some degree. Certainly, the agricultural manufacturing, the poultry industry was hit hard, and I haven't heard much about that recently, but I know that they have addressed that. Like I said, I'm not sure what the status of that is. As far as why we continue to have increasing rates around state, I'm really not sure. I think that some areas of the state are just not following the mandate as well as others. As far one thing that I feel like we're in Garland County, we're in a much better situation, and some of it is the widespread testing. But one of the things that I think that states are kind of graded on is the number of cases that occur per 100,000 residents. And in Arkansas, it's about, I think, around 2,700 cases per 100,000. And here in Garland County, we're at about 2,000 per 100,000 because the population of Garland County is approximately 100,000, and we've had a little over 2,000 cases. So our numbers are definitely significantly better than the overall state numbers.
Right. So the effects of the virus seem like they can change from day to day in some people. To take a particularly well-known example, former politician Herman Cain passed away back in July from the virus. Just a few days after it being said publicly, he was doing fine. And Herman Cain was also reportedly infected for about 18 days before finally succumbing to the virus, unfortunately. What causes this virus to be so fickle in its behavior?
Well, I think it really, there seems to be a wide spectrum of disease that the virus causes, and I think that's one of the challenges of it is that so many of the people are asymptomatic that become infected with it, and that's, they can spread it. And I think some of it is just the individual responses, and I don't know how predictable that is. It certainly affects the lungs quite a bit. That's where that's focus of the infection is. But it affects the overall immune system. It affects, or in some people, it affects the clotting of blood, and you get micro blood clots that can cause all kinds of severe problems. And then some of it, is our bodies, and some people probably more so than others, they have an immune response that it's the immune response that is causing the problems more so than the actual virus itself. So I just think, like I say, it's a new virus. Nobody really knew of it 10 months ago, and and it's really pretty amazing how far virology has come in the last, and certainly since I was in medical school. I mean, they were able to figure out the genome of this virus back in January in China, and of course people were studying it all over the world, and able to really kind of identify it so rapidly. But again, it's a different virus, and people are learning all the time. But and I'm sure there's still a lot that we don't know about it.
Thank you. Just a reminder to the audience, we still have about 20 minutes left. So if you have any questions for Dr. Shelby here, please post them in the comments and I'll try and read them off for him. So Dr. Shelby, what is the latest we know about the long-term effects of the virus for those who have been infected?
I don't know that like I say, it's a new virus, so we don't know what the long-term
Constantly
will be.
changing.
But as far as there's such a variability. I mean, some people that have not really significant disease from it still just don't feel right, even months after their initial symptoms, and from everything from just being tired, and the virus really does hang around in the body for people that have been infected for a long time. Again, causing a whole spectrum of symptoms, and I think that there can be a variety of symptoms that do persist, and I think certainly older people tend to have the disease and symptoms for longer than younger people. I know I check our database, and there are people that have been on it for 2 or 3 months and are still considered active cases because they're still having some symptoms.
Thank you. We've got a question from Tony here. I've seen many health officials over the course of the last 6 months. There seems to be as much misinformation in the local med community as nationally. Do you agree, and why is that?
I'm not sure exactly what you're referring to. I think certainly on the state level, in terms of the state government, I think that they've been really pretty consistent with their messaging, and I think the governor has been listening very much to the medical professionals, and I have great deal of respect for the doctors at the health department and UAMS. So I think, I mean, there's a lot of people have different opinions, but I think that people in leadership roles in the health community in Arkansas have been pretty consistent about the severity of this infection.
There seems to be a lot of back and forth on the consensus about the spread of the virus. What's the latest information on if the virus is airborne or not?
I think I think that's still being studied. It's certainly airborne to a certain degree. That's the main way that it's transmitted is through aerosol droplets. I think there are some ongoing studies to determine how long the virus can stay viable in the air. But I don't have any really definitive things. I mean, that's not unusual. I mean, we have airborne illnesses that have been around for a long time. The kind of the main airborne illness that caused a lot of disease, in the last 100 years has been tuberculosis, and that still exists. It's certainly not as prevalent and not as infectious as the COVID-19, but it's an airborne, and it can stay in the air a significant amount of time, and I think we'll probably get some more clarity on how long and that the COVID-19 virus is viable in the air.
Do you think the concerns behind air vents being a possible method of transmission are valid? I'm not really up to date on what the studies have been done on that. I think that there are the recommendations for the really high-powered air filters in buildings. I think that is thought to be a benefit, but as far as anything specific, I don't have any information on that. We have a question from Karen. What's the latest on a vaccine?
Well, there's certainly a lot of work done all over the world on a vaccine, and I think from what I hear, there's good progress being made on developing a vaccine that's going to be safe and effective. But any vaccine, I think, one of the reasons it takes a while is that when you're talking about vaccinating billions of people, you want to make sure that it is safe, and so I think the care taken to determine that is really important, because even if you have a bad reaction for 1 in 10,000 or 1 in 100,000, when you get into the big numbers of billions, that translates to a lot of people, and so I think safety is going to be really important, and then the effectiveness of it. No vaccine is 100% effective. Certainly, we see with the flu vaccine, it varies from year to year, the effectiveness of it, and so I think that the vaccine for the COVID-19, if they can get a vaccine that's 70% effective, I think that's what the goal is. But that means that for 30% of the people that get the vaccine, it's not going to be protective. It may be like what we see with the flu vaccine, that it doesn't offer 100% immunity, but for people that do get the flu who have had a vaccine, as a general rule, the severity of their illness is less than people that have not been vaccinated. So, one of my concerns is some people are kind of looking at the vaccine as going to be the panacea, that as soon as we get a vaccine, this is going to go away, and I just don't see that happening.
It can take a long time to distribute.
Oh yeah, the logistics of it, and one of the things that I'm concerned about is how many people will refuse to take the vaccine or take the effort to get vaccinated. Like I said before, the flu vaccine has been around for a while, and it's widely tested. It's very safe. It's very, very available. But 50% of people don't take it. So there seems to be, and I don't think it's just in the United States, but there is somewhat of a bias against vaccines these days. I'm old enough that I can remember when the polio vaccine came out when I was in elementary school, and people were very excited about it. I remember going down to my elementary school, and everybody had to wait in line to get the vaccine. I don't know. I really don't see that happening with this vaccine. But I hope I'm wrong. I hope that we do get a safe and effective vaccine soon, and that people will be lined up to get it. So I think that time will tell on that.
If you had to make an educated guess, what do you think the timeline would be realistically before we have a vaccine available?
Oh, I think it'll probably be available in some places, early next year. But as far as how soon it'll be widely available, I don't know. So I would say, by mid next year, I would say that it would be widely available. But that's just a guess.
What's the latest status on treatments for people who are infected?
Well, I think that the antiviral medication that has been approved for it, I can't remember the name right off, but I think that has proven to definitely lessen the severity of the disease in people who do have a bad infection with it. And I think that there'll continue to be a lot of research into specific treatment for this virus. It kind of, I'm very involved with the treatment of people with HIV, and I can remember when HIV just first came on the scene. There was no treatment for it, but now we've got 25 or 30 different medications that actually fight the virus and kill the virus, and so things like HIV are very, very, very manageable. and even the seasonal flu, they're antiviral medications that are very effective in treating the flu, and so. Hopefully, and I'm sure there are people looking at it that they will develop some antiviral medications that can be taken to mitigate or even help resolve the infection with COVID-19.
Thank you. We've got about 10 minutes left, audience, so if you have any last-minute questions, please get them in while you still can. Even if you've already asked a question, you're welcome to ask another. This is a question from Scotty, and Scott, we did discuss this a little bit earlier, so after this video is done streaming, you'll be able to go back and access the full video. But Scott says, my mother resides in an assisted living facility in Hot Springs. Do you think these facilities are doing a good job of monitoring family visits and other possible sources of spread coming from outside those facilities?
I really haven't heard of what assisted living facilities are doing. I would hope and assume that they are doing some screenings, but I don't have really any specific information. And I think it would vary because they're not as highly regulated as nursing homes and long-term facilities are. But I certainly I think it would be in their own best interest to really kind of follow all the mandates for sure.
Let's see. We touched on this a moment ago too, Patsy, but you may want to follow up. Dr. Shelby, Patsy says, some people I know say they are not getting the flu vaccine. What do you think of that?
Well, I don't think it's a bad idea. I think the flu vaccine is safe, and like I mentioned before, it's not 100% effective, but it does prevent a lot of people from getting the flu, and it does prevent people that do get the flu from having a severe case of it. I think there are some misconceptions about the flu. I think some people kind of put the flu in the kind of the category of a bad cold, and for people that have the flu, especially with severe symptoms, they remember that it's not a bad cold, it's the flu, and just like the numbers show, 50,000 Americans die from the flu every year, and I don't see that changing, because it can be a very bad, serious, even fatal infection.
Could you inform the audience what the easiest way to get a flu vaccine in Garland County is, and also the easiest way to get tested for COVID in Garland County is?
Well, as far as the flu vaccine, the local health unit here on Malvern Avenue is given the flu vaccine. They may take some insurance information, but there's no cost for people that don't have insurance, and so there's no out-of-pocket expenses at all. It's usually best to call because they will need to get some information from you. But the flu vaccine is available at most pharmacies, and there's a good supply of it, and so it's available. The local health unit is doing flu vaccination programs at all the school districts in Garland County. That's limited to students and staff. But if someone wants to get a flu shot, it's not hard to get here in Garland County.
We have a question from Donna, who says, just got flu and shingles vaccination and running a fever and body aches, I assume from the vaccination. At what point should I be concerned and get a COVID test?
if you're running much of a fever or you have the symptoms of your cough, sore throat, I would suggest getting tested. You can it very well could be from the vaccinations that you've had, but you could still very well have COVID. So I would suggest if those symptoms, certainly if they last more than a day or two, getting tested would be the thing to do. And we're there. Many of the clinics around the county are doing the COVID testing. Here at the health department, it's from 9 to 4 most days. I think on Tuesdays they're open from 9 to 6, and it's best to call ahead because they'll need to get some information from you. But again, they will maybe collect some insurance information, but there's no cost for people to get the COVID test done here at the health unit.
Thank you. I have a question from Karen. Do you know where those who are at high risk can get a flu shot?
Where they can get them?
Yes. This elderly, she elaborates, this elderly couple did not want to go to a clinic, I guess, risk of exposure to COVID. So maybe they want a more private way to get a flu shot.
Yeah, I really don't know of anything as far as somebody coming out to give you the shot. You might check with your primary care provider. They maybe possibly some of the clinics or some home health are doing that, but I'm not aware of that. But I would check with your primary care provider to see if they have some suggestions on that.
Let's see. We have a question from Tony about vaccines, who heard about 2 vaccines, one for older, one for everyone else. And this is actually about the flu, he clarifies. Is that true?
Yeah, there are two different vaccines. I can't remember offhand exactly what the requirements are for them. And I don't know that the health department is making a distinction. I mean, it's the same vaccine. It may just be some of the dosage is a little bit different.
From Patsy, are you aware of any drive-through flu shot sites?
I'm not. You could call the health department because they're. I know for like the COVID testing, there are people who can be tested without getting out of their car. Now, I don't know that they're doing the flu vaccines like that, but I would check with them because they're set up to do some things in the car, and they might be doing some flu. You just have to check with them and kind of explain what your concerns are.
Thank you. All right. Well, thank you, audience. Everyone had a question. Dr. Shelby, I'm about to give you a chance to give any final remarks, but before I do, just want to remind everyone, next week on a lighter note, Wednesday the 14th at 6 p.m., I'm going to be interviewing Eddie Schmeckenbecker. He's going to present on an introduction to American Sign Language. You might know Mr. Schmeckenbecker as the interpreter for Governor Hutchinson. And then also, I'm going to be having another one of these virtual interviews with Dr. Shelby here again on October 29th. That's a Thursday, also at 6 p.m. So we'll go over the latest updates at that time. And if you have any other questions, get them ready for October 29th. That's a Thursday, 6 p.m. All right, so Dr. Shelby, I'll let you have the floor. Anything you'd like to say before we end it tonight?
Well, we're going through kind of unprecedented times, and it's really interfered with so much of our lives, and so it's easy to be discouraged, and I know a lot of people are that this is just not the way they were planning on 2020 being, but we kind of have to play with the cards that are dealt to us, and this what we've got is a very serious pandemic that's still alive and well in Hot Springs, Garland County, and we just can't pretend like that we've done our time and move on. We've really, the masks really do make a big difference, and the social distancing make a big difference, and just being smart with and aware of your environment and avoid dangerous environments, because it's a deadly disease. People are dying from this every day, and it's going to continue until we can really all work together to stop this pandemic.
Thank you for that, and I appreciate your time and for you talking to our audience. I'll see you again October 29th, 6 p.m. Facebook Live.
Okay, good.
Have a good night, everyone. Be
Okay,
safe.
thank you.